Okay, okay. You brought a lot of photos. Let's take a look at some of these photos.
Yes. This was a young lady. She was about 25 years old. She was applying for jobs, and people would see this, and it made her not only upset, but in any social situation, she felt
so
absolutely...
the side tooth was missing.
Yes, it was. In one visit, we were able to give her back her tooth, her confidence, her smiling, her ability to interact, and no fear socially.
Okay, help me understand then. Let's start with a single tooth, and I have a lot of questions about what you could do for the denture wear. Why a single tooth? Why a dental implant? What's your argument there?
Oh, I think that there's no argument, quite frankly.
Okay.
The alternative for somebody who is replacing one tooth are to have something that's akin to a retainer with a tooth on it. It's something removable. It has plastic, it goes across your palate, it collects plaque, it collects debris, it can cause tooth decay, and it can cause irritation to your gums. So as an option with the one tooth, we have the possibility of this removable appliance. Similar to this.
Okay.
It is a totally unacceptable thing for most people for any number of reasons. The more common way to replace this tooth would be to whittle down two adjacent teeth, much as it is in this picture here. But here's the main reason why you don't want to do this. If we have to replace this every 5 or 6 or 7 years, each time we lose more tooth structure. Each time we have more opportunity for a need for root canal. Each time we have more opportunity to actually lose the tooth due to gum disease or other problems that occur. Fractures are very common. When that happens, you have to extend the bridge. So this starts to be a domino effect. First it's 2 teeth, then it's 3 teeth.
Is this an exaggeration? I mean, this is what happens?
It
starts with the one tooth.
There is abundant research that has shown what happens when a single tooth is replaced with conventional dentistry. On the other hand, the miracle is that an implant that's placed well in good bone is likely to last the rest of the patient's life, and it has not in any way, shape, or form taken anything away from the adjacent teeth, the underlying bone, or the gum.
Okay, so now we're just about out of time. We have to take a quick break. You have more photos. What are we looking at?
I do. All I want to show you is what can happen by giving somebody back one tooth. This young lady had a missing tooth that she was born without. She had braces on her teeth for a short time in order to get them into place. We placed the implant.
Looks real.
Look at the change in her smile. Look at the change in her persona.
She looked like a little kid before. Now she looks like a woman. Very pretty.
The story gets better. She went off to the Peace Corps. This was several years ago. When she finished in the Peace Corps, she joined with the U.S. government, and she is now in Iraq. And she is helping to change the lives of the Iraqi people as they rebuild that country.
Okay.
Here's another one. In fact, this is one of my favorite ones. This woman had been wearing dentures for 25 years. She had had all of the possible relines and attempts to make it fit better. She had probably been to 15 different dentists. All of them told her they couldn't make her dentures. Most of them told her that there wasn't enough bone. She was in tears.
Did they offer her dental implants?
They did not offer her dental implants. They told her she wasn't a candidate for dental implants. So we went through our ordinary diagnostic routine. We got the scans that were necessary, and I promised her that I would find enough bone, because it is the rare patient in my experience who we can't. She herself didn't believe. And in one visit, we were able to place 2 implants. That's all she required.
The lower jaw I'm looking at?
This is the lower jaw. We could place a denture on top of that implant with simple connectors like this, and in no time she was able to smile again. She had not been to work for about 1.5 years because she did not feel comfortable in going in without teeth, and she couldn't hold her teeth in.
It's just a snap in.
Just literally snaps in. Let me show you.
Okay.
Here's an example of a model, and you can see that there are 2 simple little snaps that barely come through the gum.
So 2 implants.
2 implants. We put this denture on, which would be like this normally. Snap it in, and it's firm.
It's that easy. And again, pain there?
The amount of discomfort that this patient had, if you were going to, she said, I have more discomfort from wearing my dentures than any discomfort you ever gave me from placing implants.
Are there denture wearers that are fine, that are okay? I mean, did they tell you, yeah, my denture's okay?
Very many people say, my denture's okay.
I mean, you think they're in denial in a way?
I don't even know that it's denial. They've learned to live with the problem. They don't anymore know what they're missing.
Then do you think they count their teeth and think, wow, that's too much money, I'm not going to get dental implants?
You know, that's another myth, Randy. The whole idea that implants are expensive. The truth of the matter is that what's expensive is conventional dentistry. Conventional dentistry that doesn't work. I don't mean to denigrate dental care, but dentistry that doesn't work. The dentistry we were talking about before, where we go from one thing to another thing, it gets worse. When a patient has lost their teeth, they've spent a lot of time in the dental office, they've spent a lot of money, and they've had a lot of tragedy around that. So consequently, if we can give them back something that is predictable, that lasts a long time, that gives them their self-esteem back.
I mean, 60 is young today.
60 is very young.
A lot of people out there in their 60s wearing dentures. And I guess, most people don't like the dentist, right? Is that why they don't go to do something about it? If it's as good as you say it is, 2 implants securing a lower denture, why doesn't everybody do it?
Well, I think the most likely reason why most people don't do it is because they don't know enough about it. And we've done a poor job.
Are they afraid of it?
Well, there's fear. There's also the fact that they're frustrated with what they haven't gotten over the years, with the process that has brought them from where they were to where they are. And for that reason, they're not happy about going through something else and spending money to do it.
Well, does a denture wearer go to the dentist? I guess for the most part they don't.
They don't.
So nobody's telling them to do it.
What's interesting is that regular dental patients, let's say they come back to their dentist twice a year. Denture patients may not come back for 6 to 7 years. And they don't even come back because they need something done. They only come back when they have a problem.
And we have to take a break. More about what you can do for the denture wearer. But final message before the break. Anybody missing teeth, and especially those denture wearers, what do you say to them?
Check it out. Find out if you're a candidate. You only have to lose your adhesives.
Only have to lose their adhesives.
The only thing you have to lose is your adhesives.
Okay, good. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Up next, more photos and some information you need to know if you are a denture wearer. We'll be right back.
Tried all sorts of cover-ups for bad breath? Try the science of BreathRx. Only BreathRx has Zytex. It attacks the cause of bad breath, keeps working for hours. It's clinically proven for real fresh breath.
Get non-prescription BreathRx from your dental hygienist and now at fine stores everywhere.
Designs for Health is the nutritional supplement brand of choice, exclusively recommended by healthcare professionals.
As a physician, I insist on the science-first approach of Designs for Health. They have synergistic formulations with optimum quantities of therapeutic nutrients.
Designs for Health, the leader in professional brand nutritional supplements.
There's a new secret to looking younger. An advancement so profound, it took a team of scientists years to create. A time machine called Zoom. Getting zoomed is the fastest way to erase years from your looks. Zoom is the most advanced teeth whitening ever. Only your dentist has it. Nothing works like it. Zoom Gel gently penetrates the submicron pores of tooth enamel. The patented Zoom Light superactivates the gel through a unique photofenton reaction, breaking down the stain's double bonds. In just 45 minutes, years of discoloration disappear, transforming your smile to wow. To find a Zoom dentist near you, go to zoomnow.com or call 800-891-4895. For your whitest, most confident, most irresistible smile, get zoomed today. Make your appointment at zoomnow.com or call 800-891-4895 today and discover the wow of Zoom.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering dental implants. With us we have Dr. Stephen Brown. Okay, Dr. Brown, you have more photos here. You like dental implants, Bob.
I love dental implants because what we're able to do for people is so exciting. You know, in all other dentistry, you asked earlier why people don't like to go to dentistry. In all other dentistry, we're doing things that are takeaway. We cut down teeth for crowns. We remove tooth
Like a
decay.
patch up or something.
Yes, we do gum surgery. Here we're giving people back what they've lost. They can smile again. They can laugh again. They can embrace life again.
You say they become more active with.
Well,
Which sounds like an exaggeration.
my experience has been that people wearing dentures and people missing teeth tend to withdraw. They tend not to want to be out in public. They tend not to want, they have to think about what they eat. They have to think about how they can clean their dentures. They have to think about the bad breath.
Okay.
All of those things. But there are other exciting